Counselling and psychotherapy in the UK is currently unregulated, which means anyone can do a course with that in the title and could set up and say that they're a therapist that's able to work with children. This creates risk for parents who can assume that all therapists are qualified equally and that the person that they're choosing will be able to help them with their child's difficulties. Choosing well starts with knowing what to look for and what truly matters, not just the surface level details. So, here are some things that I myself, as a trained psychotherapist, will prioritise if I was looking for therapy for a child. I have to also acknowledge that I have my own biases in this, so there may be other people with differing views, and that's part of the beauty of the therapy world, is that there are different perspectives. So finding the right one for you is really important. So just to think about some of the myths that people might hold, which is that if someone works with a child, they must be qualified, particularly if they're a counsellor or psychotherapist, and that's not always true. It's also a myth to think that every therapist follows evidence-based practice. What that really means in practice is that someone follows a type of work that has a high amount of evidence. Cognitive behavioural therapy is an example, which is a very structured program, but not all therapists follow this route. It's also a myth that parents don't need to be involved in a child's therapy. The reality is that that thought can mean that your child's therapy can be slower, and misunderstanding some of these points might mean that you end up with a poor match for the difficulties of your family and your child. So what do I look for myself? So looking at credentials for me are really important because it's unregulated. Somebody that is a member of a registered body such as BACP, UKCP, NCPS or ACP, for example, they're really important because they're on a register called the PSA register, which is the Professional Standards Authority, which means that voluntarily that person is working with an organisation or is registered in an organisation that sets minimum standards for training and are very rigorous in continued professional development. I also want to think in terms of credentials, not necessarily the length or breadth of the training, but do they have specific skills working with children and young people, whether that's a direct training or ongoing professional development? And also, what is their experience in that field and in the particular issue that you might be taking? Thinking about some structure around therapy is important. Now, there are plenty of approaches where we talk about non-directive, and I think that's perfectly reasonable, and that's how I would approach. But it's really important to have some structure around that in terms of what are we planning to do from the outset? How might we track progress? How regularly might we meet to review the work that we're doing? And also to be really clear on roles. What are the limitations of the therapist you're working with in terms of how they might liaise with a wider network? And are there some issues that they think they can't address? Thirdly, parent inclusion. And for me, I think as you become more of a seasoned therapist, particularly working with children, you recognise the importance of families and parents in change. Placing a child in therapy on their own is fine. You can get some really good results, and that often happens in a lot of school approaches, but not all. But actually, change can really happen and be more longer lasting when you take the family along or a family member along with the child on their therapy journey. So for me, it's really important that you feel reassured that who you're going with meets the needs that your child and your family has. Don't be afraid to ask questions. If you feel someone's not being clear or you need a bit more clarity, ask the questions and think about what criteria you would want to have in place to know that the person that you're meeting, you feel safe enough and trust them enough from the start that you think they'll be able to support you. If you don't feel like the person that you're talking to is the right person, maybe they haven't addressed any concerns, they've not been very clear on how they might approach the work, or if you're not sure of their credentials, keep looking. Good therapists won't be afraid to have a conversation with you and expect that you'll be talking to 2 or 3 other people, and you've got to go with who you feel is going to be best for you. You can look at websites such as BACP or UKCP or other accrediting bodies, and there will be advice on how to find a therapist on there, and there are plenty of well-informed articles. You can also get in touch with local therapists or local therapy organisations, and they will always be there to help you.